Hi, this is Chip Mosley with Total Motion Physical Therapy here in Raleigh, North Carolina. We're now up to part 2 on our series on sciatica. And today we're talking about diagnosing sciatica. One of the most common questions we get, whether it's someone coming into our clinic itself or whether it's someone calling on the phone deciding if they need to come to physical therapy for treatment, is the question of, do I need an MRI or a CAT scan where we can have pictures of disc details and things like that? Or do I need an x-ray first so I can help to diagnose this thing before coming to therapy? Well, a couple catches that come from that. As you look at studies of all different types over the last many years by physicians and other type of people alike, really trying to see how much of the time does this stuff really get us to the right answer on how to effectively treat a back pain or a sciatic issue. And what they're finding out in those results is less than 10% of the time does it really give us that helpful information on really how to properly diagnose and how to treat something like a sciatic nerve issue. Because we have to remember from part 1 that that impingement on the sciatic nerve could come from something in the bony level itself, or the hole comes out. It could come from the disc, but it could also come from muscles and joint alignment issues and other type of connective tissues pushing on that nerve. And there's so many things we can't really take a picture of that could be the cause of my problem. So while this isn't necessarily a horrible information to have, to us as a clinician, this isn't actually the most helpful thing for me to have when I'm trying to diagnose it as much as some other things. On top of that, just because I have a picture of something one way or another as a clinician, it actually doesn't tell me how to treat it as much as you might think. Now, there's obviously the location of my symptoms we talked about last time. Will kind of give me an idea, is this really a sciatica or not? For example, we talked about how the pain can be in the back, the buttocks, or behind the leg, or lower leg, and so forth. So if I have someone who has more pain in the groin or front of the leg, we're not thinking sciatica as much at that point, because that's not where the sciatic nerve travels. So that's another thing. But really, there's an argument that many are making these days for motion testing over radiological testing. Now, this is based on wherever there's an injury in my body, that area will try to tighten itself up to protect itself from that injury. And with tightness comes changes in motion. I'll look stiffer, I'll look weaker, I'll have discomfort. Now, specifically sciatic nerve people, they'll often see restrictions when their leg is being raised and kicked out straight. So whether I'm sitting someone in the chair, doing a leg raise test, like we can send another link on how to do some of these tests, or whether it's just someone talking about walking, they'll feel it when they stretch their leg out in front more so, things like that. That may be where things pop up. We'll also see as things tighten up on that one side in particular, we'll see functional weakness coming in that leg. Maybe I can't step up and down on a step as well as I used to. Maybe I can't squat or lunge or put the same kind of weight on that leg or cross my leg on it. So these are all things you can test. And in particular, if the sciatica is more on one side, which is the more common one, you'll notice a big difference between that and the other side. The other side may not hurt to lift or move or put weight on it or be weak. In contrast with the other, we'll see that difference between the two. We'll also see in motion testing, if things are up in here in the back and pelvic area more, you'll see motions in the spine itself more blocked on one side and tight on one side. Maybe I can't turn one way as well as I can the other. Maybe I can't side bend or bend forward or backward to one side as well as I can the other. Now, these are things that not only are you going to see pretty much every time you see a sciatic nerve issue, so whereas this is less than 10% with radiology, this is almost 100% of the time. These are also the ways that will help the clinician to know how to treat that patient. When I see someone with a restriction in this type of movement versus that type of movement, gives me an idea as to where this problem really is pinching more so, and what type of things we might need to treat it as well. Next question I have is, well, do I need surgery? Well, if I have someone who calls up and says, I can't even sit down for 2 seconds or stand up at all straight, I'm crawling around on my hands and knees, I'm at a million out of 100 scale pain, and there's just nothing, I can't even take a breath. Well, those people you might say, let's go ahead and maybe send them on and get that, that radiology. Maybe there's someone who needs surgery potentially today. But the majority of the time, if you can actually have the wherewithal to walk into a clinic and have someone take a look at you, usually we can see that conservative methods have more often than not will be needed more than surgery. And there's a last thing I didn't include on my list here, that's also a response to treatment. So if you come in to see a clinician like myself and you're feeling certain pains, we're seeing movements show up in a certain way, if I have someone that we can try some treatment and we see an improvement on that, Not only does that tell me whether or not they're a good patient to have in the clinic versus to send on to a surgeon, but that also helps us to diagnose where this pinch is. There's certain things as clinicians will know if the pinch is more from the back with a sciatic. Certain types of treatments will respond a certain way. If it's more in the buttocks, certain types of treatments will respond a certain way as well. So these are other ways that us clinicians can break down where that pinch really is, even if we didn't have that picture more so. So I hope this was helpful for you. So next time you have yourself or someone you know or love or work with that has things and you're wanting to know, do they fit into this category? Should I call it sciatica? Think about these things. If you're stumped and don't know what to do with someone or yourself or you're still struggling, certainly seek out help as quickly as you can. The faster we can treat these things, the less likely people are to head on to surgery. Thank you.